Hi, everybody. This is the Dr. Debunk Weekly Podcast Show. On this show, I'm going to be debunking the medical myths, garbage, and crap that's spread by doctors and other health professionals. Dr. Debunk is the medical truth teller. Today's podcast is titled Introduction to Optimal Health. Now, I've mentioned this in a couple other videos and given you little bits. And you can look at the video on my website that is very similar to this to get some little more information. But today, this will just be an introduction. I really won't go into detail, but just to give you a big picture looky-loo. So, optimal health living. What does that even mean? Well, it's a descriptive title. It's a descriptive title regarding the prevention of disease and the promoting of high quality of health. I mean, everybody wants to have high quality health. Everybody wants to live a long, full life. Everybody wants to have the best quality of life. But what does that even mean? Well, those of us in the field for really 40 years now that have been trying to understand that have kind of settled on optimal health living. I mean, it's been called many things: preventative health living, healthy living, anti-aging medicine. I mean, the list goes on and on. But I think descriptive terminology is better. And so what it really means is, what are the factors that cause the human body to be optimally healthy at all decades of life? And so for those of us in the health professions that have actually tried to study this and see what can be understood scientifically, and really those of us that have been fascinated by it, we've come to call it optimal health living. And so the professionals involved in this study include physicians, naturopaths, homeopaths, medical researchers, and many more. All of us, for the last 40, 50 years, have been trying to understand what are the factors that maintain optimal health at all decades of life. And honestly, medicine is the most minimalistic in this field. You know, doctors make up the least amount of people interested in this, or professionals, because we're, as I've mentioned before in other podcasts, disease-oriented, disease. One way to look at it is, medicine is trying to find the bombs of terrorists, and we're trying to find them like just before they go off, and then we try to contain the explosion. But the bomb of disease still explodes. Optimal health is really about trying to prevent the bomb from blowing up at all. Doctors in medicine, we do early detection stuff, and that's interpreted as prevention, but it's not. I won't go into that again. You can go on the website, that's on there. But nowhere in medicine do we study true prevention. I mean, we don't study it in medical school, we don't study it in residency, and we don't study it after we practice in our clinical practice follow-up education. We study early detection of disease, diagnosing of disease, and treatment of disease. Though that's it, that's what we do. Now, again, I have to always say that early detection is important. Early detection of disease is very important, but it's not prevention, and it's even farther away from optimal health. So, optimal health is outside the scope of medicine. So doctors that know anything about it at some point begin to look outside of medicine because we realize the inadequacies of what we're doing. So I started about 22 years ago. I had been a doctor about 10 years, and I really realized, man, I'm just not doing anything to make my patients more healthy. And I mean, I'm just a licensed drug pusher in many ways. And not that that's bad, because the controlled use of symptomatic relief of problems with drugs isn't bad. But I wanted to know more. And patients wanted more. I mean, in the last 30 years, in the time I've been a doctor, there's just been a big resurgence or a big increase in patients wanting natural treatments. So I began to look outside of medicine for what things actually seem to produce more healthy patients. And so, I don't know, the first 10 years, I practiced pretty standard medicine. And then I began my quest. And so here we are 22 years later, fast forwarding. I mean, I really think I have something to contribute. And that's what this podcast is about. Because for the last 22 years, I've been focusing more on the natural optimal health treatments, lifestyle changes, than drugs and medicine. I mean, right now, I can't tell you about any of the new drugs that are out on the market because I don't really care about them. I don't want my patients taking new drugs. I don't want my patients taking any drugs unless they're broken with disease. I'm trying to get them off drugs, first changing lifestyle to correct the body, and then... But I think in one way to put it or to say it, I've been trying to answer two questions. For 22 years, the last 22 years, I've been trying to answer two questions. First, as I've already stated, what are the factors that give people optimal motivation, energy, endurance, and strength at all decades of life? And the other question I wanted answered was having to do with the process of disease. In other words, you can watch patients as they live over the decades of their life. You can watch how they die of disease and the process of it. And so as I've looked at all that, I decided that, well, as I see how patients live to get disease, well, then I want people to live the opposite of that. I mean, the question becomes, what is the opposite lifestyle that inhibits or even eliminates the process of a body breaking down with disease? Because if you don't die of disease, then by definition, you'll die of old age. I mean, everybody dies of something, but we don't really think about it. But I can tell you there's only two ways you're going to die. You're going to die of old age or you're going to die of disease. And there's a big difference between the two. Because there is a body that wears out of old age and doesn't die of disease. And any coroner in America could tell you that. Any coroner in America could look at a dead body and tell you that that body died of disease because you can see the degeneration, the degenerative processes that have destroyed multiple organ systems, because it's generally more than one. But dying of old age is just where finally an essential organ, heart, lungs, kidney, liver, finally wears out. And you can see it. You can see it microscopically. You can see it at a large scale. Macroscopically is what we call it. I mean, dying of congestive heart failure from disease is very different than dying from old age heart failure. And the proof is just in the numbers. I mean, again, as Dr. Debunk likes to say, talk is one thing, reality is another. Americans die from 72 to 80 years old. I mean, it's a big range there because it depends on the data you look at. But Americans that die of old age live to be 105, plus 5, minus 5. There's variability there, but it's 25 years longer. And the quality of life is excellent till the end. I mean, when you watch somebody die of old age, they have pretty good quality of life till the last 6 months, maybe a year. And then they're gone. And remember, we just defined quality of life by the 4 words of optimal motivation, energy, endurance, and strength. Now, of course, with age, we're losing a percentage of motivation, energy, endurance, and strength. But when you die of disease, I mean, your last 7 to 10 years of life, they're really, really nasty. I mean, it's just, watch somebody die of liver disease. It's not a happiness, and they don't even get 7. But congestive heart failure, lung disease, whatever, cancer is really variable. But the last years of your life really suck, to use a precise medical term. We call it circling the drain. It's kind of the sick, sarcastic humor we have in medicine, but we talk about people circling the drain when they're in the ICU and then they go down the drain. But with disease, you're really circling the drain for years. Sorry, I like sick humor. It's kind of fun. Even though this is obviously a serious topic, I'm just saying it doesn't have to be that way because it's 6 months or so when you die of old age. So after 32 years of watching people live and die, especially looking at the second 50 years of life, I've come to believe in certain principles. In other words, I've more precisely defined what I believe the optimal health living is all about. And so those of us that look at this define it differently. We talk about different aspects of it. I've come up with what I call the 10 theories of medical science that are behind the optimal health principles. There are 10 concepts or 10 models of aging that produce an optimally functioning human body at all decades of life. It's a way to live and also a way not to live. It's based on the best science that I can find and the theories that are behind how the body works. So everything I've said to this point has been kind of an introduction to optimal health. And so what I'm going to do from here on is just list the 10 theories of aging or the 10 concepts of optimal health living and not really go into them. And then in the future, over time, I'll do them all in podcasts. There'll be detailed videos and more so that you can understand what it takes for you to achieve an optimal health lifestyle. Now, before we get into that, I think it's time for a little break from our sponsor. Hi, everyone. It's the cold and flu season again, and this year's pretty nasty. Well, do you know what the best cold and flu remedy is? Well, it's a remedy that would be natural, strong, kills viruses, and has some science to show that it really works. Well, that's KSK Cold Spray. KSK Cold Spray is an all-natural, germicidal spray that eliminates cold and flu symptoms in 24 to 48 hours. I proved it in a study of 200 patients, and now we've probably had 700 people that have used the spray. Every year it's curing hundreds of my patients. So don't be miserable anymore. Go to kskcold.com, that's kskcold.com, and you'll love what you read. I'm Dr. Debunk, the medical truth teller. Welcome back from the break. Okay, we were talking about getting into the 10 actual theories of aging. Now, first principle is each theory is just as important as the next theory. One's not more important than the other. There's no order here. I put them in kind of the order of the way I like them. But one theory may have a greater consequence than the other. I mean, I think there's the top 3 theories that carry the most weight that impact your health. But the bottom line is there's going to be a consequence of a greater or lesser degree depending on which one of these you violate, the degree you violate it. So here they go, in no particular order. Theory number 1, it's the circulatory theory of aging. Number 2, the oxidation-inflammation theory of aging. Number 3, the pollution theory of aging. Number 4, the hormone, nutrient, vitamin, mineral precursor theory of aging. Number 5, mental health theory of aging. Number 6, the permeability theory of aging. That just means leaking. We are leaking with age. You can ask anybody who's 60 years old or older, and they will tell you, yes, the body starts to leak with age. But this is really about cellular leakage. The rate at which our cells are leaking is the rate at which they're aging and dying. And then number 7 would be the nutritional diet theory of aging. 8 is the sleep theory of aging, which just means the rate at which you're sleep deprived is the rate at which you're going to age and die. Then there's the genetic-epigenetic theory of aging. Epigenetics is a new evolving aspect of genetics, which I won't get into, but it's exciting stuff. And then finally, number 10, the infectious theory of aging. And I will use that, I think, as an example here. So that's right. I'm going to do 2. So let me give you a little bit about 2 of the theories of aging so you'll have an example to understand it. So the infectious theory, let's talk about that. Because this is one of the newer theories and it's really fascinating to me. And it basically says this: the rate at which we're being infected is the rate at which we're aging and dying. The rate at which we're being infected is the rate at which we are accelerating our march towards disease. Now, what does that mean? Well, so here's what it means, the infectious theory of aging. The germs that are on the outside of our body are getting into our bloodstream, and then from there, they are getting into the tissues of our organs. See, the human body is covered in germs. I mean, if you could see germs, you'd probably never leave the house. You'd never want to see your body. We basically look like walking beehives. And as long as the germs stay outside the body and outside our bloodstream, it doesn't matter. But as they get in, the rate at which they get in is the rate at which they're destroying organ function. There's really good science to know this is true. This idea that your blood is sterile, it's fiction. Our bloodstream is never sterile. We doctors have believed that for a very long time, but now we're starting to realize it's complete nonsense. It's a matter of concentration. I mean, our bloodstream is vast. If you said, well, it's true, there's 30 million roads on planet Earth. 30 million roads. You have over 300 times more roads in your body that make up your bloodstream. All the veins and arteries in your body, there's 300 times more of those in your body than in the entire planet. It would take 300 planet Earths to equal the same a roadway. There are hundreds upon hundreds of trillions of things floating around in our blood. And the idea that there's never any germs there, it's ridiculous. It's ridiculous. It's always a matter of concentration. There's always germs in your bloodstream. But under normal circumstances, the germ load is below our ability to measure or see. We can't see the damages they're causing. And so with age, it's catching up. I mean, you got to remember something, and this will probably be gross to some of you, but from your mouth to your rear end, that's a hole that goes through the human body. Our entire digestive tract is outside the human body. The skin on your intestines is just a little different than the skin on your arm, but it's outside the human body. But the germ count in our intestinal tract is in the trillions upon trillions. And these germs have the easiest way to get into our bloodstream. Germs in the bloodstream, or germs in the intestinal tract, are the greatest source of invaders to the human body. And over the decades of our life, more and more and more are getting in to where they don't belong. And so the goal of understanding this, of the theory, of the infectious theory of aging is, we want to minimize that effect. How do you minimize the effect? How do you minimize germs getting in to the bloodstream from the intestinal tract? Well, there's this whole way to do that. It's a whole way to live. And this is what's, an exciting new area, because you can, people that are obsessed, a lot of naturopaths, dietitians, researchers in that field, they're obsessed with intestinal health, and for good reason. And you hear about probiotics and all these other magical things. Well, I don't mean that. Probiotics are good. There's just a lot there, but it's only one aspect of this. But you can live a life so as to minimize the rate at which germs are getting into your body. Because, see, these germs get into the tissues and cause these microscopic infectious sites or loci. Really think of it, when you see a little teenager with all the pimples on their face, that's what's happening to our organs. The germs are causing little abscess, micro-infection sites, and it's destroying organ function over time. I'll do that again. It's destroying organ function over time. Okay, another model of aging, or theory of aging, that's probably my most favorite, is the circulatory model of aging. And so that says the rate at which you are losing circulation to the cells of your body is the rate at which you are aging and dying. The rate at which you lose circulation to your body is the rate at which you are accelerating your speed towards disease. Okay, let's put this in perspective. There are 40 trillion cells in the human body. Not billion, not million, trillion. There are 100 billion capillary beds, that's B, billions, circulatory beds that feed those cells. Well, what does that mean? Well, there's 40 trillion homes in your body, and there's 100 billion supermarkets to feed those homes. And so that means that there's like 400 to maybe 500 homes surrounding a little supermarket, and all the people that live in those homes, or the cells of your body, are fed by those supermarkets. So that means the blood goes into the terminal capillary bed, and all the people in the homes would go there to get their oxygen and food, and they take all their trash there to get rid of it. 100 billion supermarkets. Well, if you lose 2 to 3% of circulatory flow, if the blood flow doesn't get to the last 2 to 3% of those capillary beds, and we believe this starts in the mid-40s, and that's because of another theory of aging, the inflammatory theory of aging, which has really proven it to be true. It's absolutely true. Well, all of this is starting, this is going on for all of us. Then by the time you're 75 years old, if you're losing 2 to 3%, starting at 45, you've lost 70 to 90% of your cellular function. Right? I mean, you've lost 2 to 3% times 35 years. That's 70 to 90%. That means those cells are not getting blood and oxygen. They become non-functional. They're either dead or hibernating. I mean, most people don't realize, but humans hibernate. We hibernate just like bears, only we hibernate at a cellular level. The cells that are damaged, the cells that are not getting good circulation, hibernate to stay alive, probably for years. We don't really know. But that means you're operating now at 10 to 30% functioning. You're 10 to 30% of what you were when you were 40 years old. And isn't that what you see when somebody's going to be dead within 5 years? I mean, if you're, going to be dead at 80, at 75, don't you walk around at, 10 to 30% functioning? I mean, don't they walk around like they're half dead, soon to be all dead? That's exactly what any doctor would tell you they see when they have patients for long periods of time. You watch them decay in their functioning. You watch their optimal health. You watch their motivation, energy, endurance, and strength drop down to 10 to 20% of what it was 30, 40 years earlier. And so this is what we observe, and this is just based on one of the 10 theories of aging, which leads to then, how do you prevent it? What would be the best thing to prevent the loss of circulation? Exercise. Hard exercise, and very specific types of exercise. And this is why exercisers, people that exercise their entire life, will just about outlive any other type of person. I mean, they'll definitely outlive people with great nutrition. You could take somebody, and I've seen this numerous times in my 32 years, that is kind of a food nut. They want to eat clean foods, organic foods. They don't touch a lot of stuff, vegetarians or near vegetarians, but they don't exercise. And then you have a guy who's like not eating so good sometimes, gets better with age, but still, eating stuff shouldn't be eating. But they exercise like, hard their whole life. The exerciser will always outlive the nutritioner. Every time I see it again and again. Now, it doesn't mean that you could live on junk food and exercise, and that wouldn't accelerate the rate at which you're going to age and die. I'm not saying that. I'm saying that the human body, as long as it has enough good nutrition, can deal with the bad aspects of a bad nutrition better. It can deal with that better than people that don't exercise, because the life is in the blood. The life is in the blood. You lose blood supply to cells of your body, they hibernate and then die. And so what we call this, well, what I call it, what I've come up with is cellular suicide. If you don't exercise, then you're committing cellular suicide at a rate of 2 to 4% or 2 to 3% per year, starting at 40, 45 years old. It's slow suicide. There's no other way to say it. So here's the question. Do you want to commit cellular suicide? Well, if you don't exercise, you are. So the goal then is to maximize how you live so as to promote optimal circulation and therefore minimize the speed at which you age and march towards disease. Now, there's a lot more to it than what I just said, because how you exercise and numerous other factors. But that will be a comprehensive podcast and video that's coming. So, over time, I will put comprehensive information on the website that will go over each theory in detail and then give you the compensatory life-changing thing you need to do, what you need to do positively and what you need to get rid of negatively, so that you can progressively change your life towards an optimal health lifestyle with these objective factors. It's not just all random. It's complex. I mean, you hear so many things about what healthy living means. And this is a model that puts it in precise, objective terms. So I'll end with this. The top 3 things that are making Americans lose their health. In other words, what are the top 3 of these 10 things that are relevant to the way we live in modern America? What are the top 3 that make Americans march towards disease at an accelerated rate and increase the speed at which you age? What are those things? 3 things. We eat too many carbs, we don't exercise enough, and we don't sleep enough. Those 3 things are the things that will cause you to prematurely age and prematurely get disease. Now, there's a clarifier. I'm assuming that you're a normal, successful, living American, and you're not still doing crazy stuff that young people do. Booze, coke, drugs, psychopathic living, mental health, nutty choices, stressing, anxiety-laden, depressed, never sleeping, crazy person. I mean, if you're doing all that stuff, you're toast. I mean, you're extra crispy or well done. You'll be dead at 50 to 60 years old if you do all that stuff. But if you're just a regular, everyday American living your life, trying to do the best, blah, 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 eating too many carbs, not exercising enough, and not sleeping enough, that will accelerate your speed of aging and marching towards disease more than anything else. So, I'm Dr. Debunk, and this is an introduction. This has been an introduction to optimal health living. Thanks for listening.